Japan has responded to a spike in confirmed cases by saying it will double its testing capacity to 20,000 a day. The announcement comes as Prime Minister Shinzo Abe is set to declare a state of emergency. The capital city reported 148 new cases on Sunday. And for the latest on this, let me bring in our correspondent, Grace Lee in Tokyo. Well, Grace, what does the state of emergency entail for Japan, and what major changes will the country see?
Well, this would give a lot more power to local officials who will then be able to restrict the movement of some of the residents here. They would be able to ask people to stay indoors, shut down some major businesses like malls, movie theaters. They would also be able to take over certain buildings without permission from the owner to set up makeshift hospitals. But a lot of these measures are preventative, things that have already been ongoing in Japan, like shutting down schools. That's something that Prime Minister Shinzo Abe ordered about a month ago. And of course, asking people to stay indoors, that's something Tokyo's governor has already asked residents to do. Largely, people have been trying to stay indoors since she asked them to. But the big question is, why hasn't Japan been doing this all along as we continue to see that surge in numbers? Now, hospital workers and doctors here in Tokyo have declared a separate state of emergency, saying that they don't have the capacity to deal with the number of coronavirus patients that they're currently seeing.
Yeah, and Japanese medical staff, as you mentioned, say that they're very concerned about medical supply shortages and the rising number of cases. But considering the number we just saw, Japan is way behind the U.S. and the bigger countries in Europe in terms of confirmed cases. So does Japan have the capacity to deal with a major surge?
Well, doctors here say no. They say the biggest problem here is the lack of doctors who have the technical expertise to deal with coronavirus patients and to deal with the hospital equipment that would help them recover, such as ventilators and breathing equipment. Those are things that are specialized. They just simply don't have enough doctors who can make sure that these patients are okay, and that's their major concern. They say a lack of equipment isn't really a concern. Even if they have the equipment, they don't have the medical staff who would be able to help. And of course, bed space is another major issue because of an infectious disease law here in Japan. If you're tested positive for the COVID-19, even if you have very mild symptoms, you still have to be hospitalized due to that law. So they're going to see a surge in patients coming in. Even if they have very mild symptoms, they will take up that bed space and take up that attention from the doctors. And as they do so, medical staff say they're simply going to get overwhelmed in the next couple of weeks. They say the next 6 weeks will be critical, but as we've already seen, Tokyo is surging in numbers, and they say that number just keeps going up exponentially, and soon these doctors, they'll simply run out of people to take care of the others.
Yeah, certainly the pressure is on for the public health system there. Thanks so much, Grace Lee, for bringing us the latest from Tokyo.